You are not a horrible person or a horrible healthcare worker just because you're thinking, feeling, and behaving that way. It's burnout, it's not you.
Hi there. Welcome back to Mindcare podcast, a podcast on mental health matters.
Now, this week, our episode regarding the healthcare worker burnout continues, so let's get started.
It's important to see things as they are, not as they aren't, or not as you wish they could be. You see yourself and you're thinking and behaving in ways that are not up to standard. Then just take it. Be clear about it that, okay, this is what's happening to me. It's not okay. Then be kind to yourself. Recognize that it's burnout and you are not a horrible person or a horrible professional, a horrible healthcare worker, just because you're thinking, feeling, and behaving that way. It's burnout, it's not you. There has to be an element of forgiveness of yourself because tao lang. Hindi bawal mapagod, hindi bawal magalit. Again, it's very romantic. Never fear the doctor is here. We're also human. And maybe we can shift the perspective a little to seeing ourselves as delightfully human, even when less than delightful things are happening. And these are reactions we have to highly abnormal circumstances. We are being asked to live a life we never lived before. We are asking to practice medicine in a way we never thought we would. It's so stressful. So, please be kind to yourself. If you're getting angry with yourself for not being able to love your patients as you dreamed about doing, well, let's start. Maybe you can look in the mirror and love yourself too. Or maybe love yourself first. It's very hard to have it for your patients if you don't have it for yourself. So that's another thing to remember. Also, if you have to cry, cry it out. We are allowed to have feelings. Feelings are like a bottle of soda. If you keep it in and you shake it, because the pandemic is shaking all of us up in an amazing way. If you don't open up about it, if you don't let it out, it will explode out in ways that are not under your control, in ways that you cannot control. And can make a really big mess that you have to clean up anyway. Best to really just let it out, find people that can support you through it. I don't advise people who are just as burned out as you are, because it's actually one of the things that contributes to burnout in the workplace. You're not able to give or receive support to your coworkers. So it's all of a piece. You could all be feeding into each other's burnout. Maybe you have family, friends that are going to better be able to support you. Next is, for some of those who are burned out, it helps them to help others and not in the patient care factor, which is what contributed to the burnout to begin with, but maybe to reach out to a colleague who also looks burned out and needs help. Only if you're able to do so. And only if they're able to receive the help as well. How does that work? So, by definition, we all went into service professions, healthcare professions, because inherently we do want to help. And the helping gives us pleasure. And also, this breaks the streak of always COVID. So, we're suddenly helping a colleague with a different sort of problem. And a lot of the times, if you're all going through the same thing, seeing the problem, seeing the trouble from the outside, gives you a little more perspective on how to help your colleague and how to help yourself. But again, no pressure. It's only if you're in the right time and space to do that. Be a good teammate also if you can, because having a good team with you staves off a lot of the burnout. Part of my work with the frontliners is that we screen them and debrief them after their COVID duty. If you ask them what's been helpful, especially the younger ones, the newer ones, who statistically are actually more likely to get burned out, they always say, it was my seniors. They're able to teach me what to do. They're able to show me the right thing to do, the right way to go about these things. So they get more confident and more calm about doing their job in spite of the volume. So things to remember, no? Be kind, let it out, assemble your own army, your own support group. See if you're also able to be part of someone else's support group.
If you decide to take a leave as a resident, how do they process taking a leave of absence for themselves and caring for themselves, knowing fully well that their coworkers that they all care and love will suffer more because of taking a leave for themselves?
That's a really, really good question. If you notice that you are burned out, you're overworked, and a leave will really, really help, be realistic. Plan it out. It's not very realistic to realize that I'm burned out today. I'm going on leave tomorrow. I'm not showing up tomorrow. Sorry, world. That's not really that's not the reality that we're all living with, right? We know that in healthcare, every time you leave, somebody else has to do the work that you left. Okay, so of course that increases the pressure. What all of you can do as a group, this is also where good teamwork comes in. Schedule it already. You go on leave from this time period to this time period, we'll cover for you, and then it will be this person's turn, then it will be my turn, then let's all just take turns. That kind of thing. It's true that people will be working harder because you're going to be out for a while, but at the same time, they're also going to be out for a while and you'll be covering for them. And the more of you who are able to get that rest, the more likely each of you one at a time will be coming back stronger, able to take more for a little while. In effect, it's all just a matter of taking turns and covering for each other. Okay, so how else for those who are in private practice and are experiencing burnout, that's also entirely possible. If you plan to take your leave, plan it out. Get someone to cover for you, and then, you can offer to trade hours of work so that you'll be able to take turns also with resting. That's one. Then another is to delegate your tasks more. So a lot of the things, filling up simple forms, maybe some other member of your clinic staff can do that for you. And actually, if it takes you a few weeks before you can plan out the leave because you have to finish your other tasks and plan how to keep things running while you're not around, take those weeks. But in the days leading up to the actual day, you talk about it so that it becomes a little more real. So if you're seeing patients, you say, hi, so I'll be going on medical leave from this time to this time. So I'm going to ask someone to cover for me anyway. Don't worry about your care, then I'll be back after. That kind of thing. So that on your actual leave, you won't be tempted to take it back because no one knows anyway. Also, learn to say no. As trainees in school, we're always trained to say yes to everything we're being asked to do. In the name of it's all part of training, in the name of it's all part of becoming a better doctor. All of that is true. But again, it has to be realistic. Are you really able to say yes to all the things you've committed to do? And you're not a bad person for having to say no sometimes.
That's really great advice, actually. They've been so busy taking care of others that they weren't able to plan ahead of time yung preventive strategies. So I think that's actually something that's realistic, as you said, and could really have a huge difference with healthcare burnout, especially during the time of COVID. Because a lot of people who have taken leave of absences, they experience, I don't know what you would call it, the days before coming back, there's a huge sense of dread because they've already experienced burnout in the past. So they experience the anticipatory feel of the dread, yung that kind of burnout again. How do you manage that? Kasi minsan parang what I see is it has led to depression, from burnout to depression, kasi they already had that 2-week break and they know, oh, ito pala yung feeling of not being so burnt out, and they get sad over the fact that they have to go back to work.
Right? So, very common feeling. Well, number one, I think it's very important to remember to not be afraid of feeling better. Okay, so don't be afraid to feel better and don't be afraid to feel the sadness and the stress again later. Because being sad and being stressed, they are actually normal emotions. Being anxious, it's also a normal emotion. We only cross over into mental illness again if these are not controllable and these are debilitating such that we're not able to function. So, yes, going back is stressful, but going back doesn't necessarily mean that you're going to go back to burnout again. Why is that? Because hopefully, during those 2 weeks that you use to rest up, you also use it to realign. Remember your why, what is the meaning of what you're doing, and what is a more efficient use of your time. What tasks can be delegated? For those who are in private practice, what is a realistic patient load for you? That kind of thing. Because nobody is on duty for nights and nights straight. You have to be able to shift your lifestyle a little to make it all more sustainable. Because if you expect to rest from your burnout, come back recovered, only to do more of the same, then let's just go straight into depression because it's not going to change. Walang magbabago kung walang pagbabago. Come in from your leave, from your burnout, with a game plan on how to make things a little more sustainable and be more mindful. If you're trying to get back into things and then you're starting to see that you're back on the road to hell, hit the brakes, realign, prioritize, because you already know how burnout feels and you don't have to feel that way anymore.
And then the last question that we have for this podcast right now would be, when should we decide to seek professional help? So we've already discussed all of the things that we can do for ourselves and supporting each other. What about when it comes to going to a mental health professional?
ang psychologist, psychiatrist, or counselor, hindi lang siya para dun sa mga may mga sakit na. Pwede rin sila dun sa may mga pinagdadaanan. At ang pinagdadaanan nating lahat ngayon, hindi yan biro. And ang pinagdadaanan ng healthcare worker ngayon, lalong hindi yan biro. So, when do we seek consult? Anytime you want. That's the quickest, easiest answer. Anytime you want. So this brings us into the next, stigma. It's very difficult to consider, even accept that we're having mental health problems when we're the ones who are supposed to be taking care of those who have problems. Doctors are horrible patients. I should know. I'm a doctor. I'm a patient. We're really horrible patients, but the thing is, you don't have to be a patient before you see consult. You can actually just ask to be checked. How is that useful? Because if you noted to have burnout, or if you already know you've got burnout, it might be very, very useful to talk with someone in order to help you realign, help you remember your why, help you sort out your priorities, and, to help make that change that you want to make after taking your leave into something that's a little more realistic. That's what talking with a professional can do for you. All right. So just because you talk with us, that doesn't mean that you're automatically quote unquote crazy. That's not a clinical term. So it will still be confidential, definitely. A lot of healthcare professionals feel alone in the thought that maybe they need to consult because they kind of feel that they're the only one. They don't know of anybody who has gone for consult. So something to think about. Why don't you know of any other healthcare professional who sought consult? Because the mental healthcare professionals don't tell anyone. It's confidential. Okay, so that's one important thing to remember. And well, when does it get a little more urgent to talk with a professional? When what you're feeling, what you're experiencing, how you're thinking and behaving, they're debilitating already. You're not able to function. You're not able to take care of yourself. When your distress is intolerable, you can also come for consult already. Coming for consult is not so much a stain on your becoming a healthcare professional. It's actually the other way around. It's making sure that there will be no future stains. Okay, so baliktad. And the goal for coming to consult is to come in having a hard time and to leave hopefully a little more relieved and with a game plan on how to make things better later. What do some healthcare professionals do? They try to find a mental health professional who is out of their circles. So that's useful so that there's no stake in having to keep it secret and there's a little more distance. You feel a little more free and able to say everything that's on your mind and that's on your heart. So that's one way to go about it so that it's still pretty much anonymous and it's a bit easier. Okay?
So talking to Dr. Trina was a very enlightening moment for me. Although this podcast primarily serves to help our audience members, I feel that talking about healthcare worker burnout was just as much of a healing moment for me. To be honest, getting into our interview, I didn't expect these emotions to come out. Besides remembering my colleagues I've seen suffering through burnout, I also remembered my own. So Dr. Trina's message will help a lot of us moving forward during this pandemic especially.
Indeed, that was a very great conversation between you and Dr. Trina, and I do hope that a lot of our healthcare workers will be able to listen to your conversations as well and understand what it means to really be there and understand their own mental welfare. Before we end, we would just like to thank all of our frontline and healthcare professionals once again who are working non-stop during this pandemic. We see these stories and posts about the different struggles and challenges our healthcare workers face each and every day, and it really doesn't end. So once again, thank you very much from all of us here from Mindcare Club for all that you do.
So just as a reminder, this podcast is not a substitute for any consultation with a mental health professional. But if you feel like you need to talk to someone, you may head to mindcareclub.org to take your very first step.
Join us again next week as we continue to lessen sadness in the world, one podcast at a time.
Bye!
Bye!